Our next speaker is, in fact, our keynote speaker, and he is the highest official responsible for drug control policy, sometimes referred to as the United States Drug Czar. Our Gil Kurlikowski is, in fact, the director of the Office of National Drug Control Policy. Mr. Kurlikowski was nominated by President Obama for this position and confirmed by the United States Senate. As director, Mr. Kurlikowski coordinates all aspects of federal drug control programs and implementation of the President's National Drug Control Strategy. Mr. Kurlikowski brings 37 years of law enforcement and drug policy experience to this position. He most recently served 9 years as the Chief of Police for Seattle. He was a Deputy Director for the United States Department of Justice, Office of Community-Oriented Policing Services, and he worked in the St. Petersburg Police Department. Perhaps most importantly, Mr. Kurlikowski in the 1980s was the commissioner of the Buffalo Police Department and did a tremendous job in that role as well. Mr. Kurlikowski was elected twice to be president of the Major Cities Chiefs, which is comprised of the largest city and county law enforcement agencies in the United States and Canada, and was also elected president of the Police Executive Research Forum. Mr. Kurlikowski has received numerous awards and recognition for leadership, innovation, and community service, and he served in the United States Army, where he was awarded the Presidential Service Badge. Mr. Kurlikowski also served as chair of the board of directors of Fight Crime, Invest in Kids, a national organization that advocates for evidence-based programs that prevent youth from being involved in crime. Mr. Kurlikowski received the American Medical Association's Dr. Nathan Davis Award for Outstanding Government Service in 2011. Mr. Kurlikowski holds a Bachelor of Arts and a master's degree in criminal justice, as well as an honorary doctorate in humane letters from the University of South Florida. Please join me in welcoming our drug czar, Mr. Gil Kurlikowski.
Changes.
Yeah, that advances.
I'm deficient in technology, so I just want to warn you all of that now. It was tough also following those wonderful kids. Weren't they terrific? You should give them another hand. Last week I followed a group from Chicago of high school students that did this incredible dance, talking about how they wanted to be drug-free, etc. So I said, let's see, I can't sing, I can't dance, but I'll do a little bit of lecturing to you this morning about this particular problem. I'm always looking for a reason to come back to Western New York, to come back to Buffalo, and I can't thank the United States Attorney enough for that invitation. It's great to be back with friends and to see friends and to be with colleagues in the law enforcement community. I also know and understand how much you appreciate Bill Hochul and the leadership that he has shown on this issue. The United States Attorney's Office here, working with so many different partners, not just their law enforcement colleagues, but so many others, to deal with this problem, because it's a public health epidemic, and that's what Dr. Frieden, the head of the Centers for Disease Control and Prevention, has called it. And that is a technical term, and we're going to talk about some of those numbers. But quite frankly, I think I'm preaching to the choir. But also the leadership that Bill and his staff and others have shown in putting this conference together, because it isn't just about a criminal justice problem. We're not going to arrest our way way out of the prescription drug problem. We have to figure out, as Attorney General Schneiderman said, smart and innovative ways to deal with it. And through technology, through education, through prevention, through awareness, there are a lot of ways. As a longtime police professional, sometimes you can get a little jaded or a little cynical in that business. This is one area in our drug problem that I am incredibly optimistic about. And being here today with around 500 or 600 people that are so dedicated and committed to come out and spend the day learning more about this problem gives me even more optimism that we are going to make a real dent in this. And as the Attorney General also mentioned, you hear this wide array of people talking about it from different perspectives. And some of the stories are absolutely heartbreaking. But to see the courage of families, not only here in Western New York, who have been directly affected by the prescription drug problem, but, and I've had that opportunity to talk with folks across the country who have lost loved ones and who have now dedicated themselves to figuring out ways to bring this to the public's attention. And those kind of stories, I think, are particularly powerful. So you have this great confluence going on right now in this country to deal with a problem that we don't have to be as concerned about our south border and how do we have enough border control. This is an issue that's coming, as you know, right out of our own medicine cabinets. So let me tell you a little bit about ONDCP. It's the Office of National Drug Control Policy, often called the Drug Czar's office. I have a colleague, by the way, in Russia. He's a real czar, and I'm just kind of a faux czar. It was established in 1988 after the death of a very famous athlete, Lem Bias, and the members of Congress, led at that time by Senator Biden, were pretty frustrated that they couldn't get a handle on, look, how big a problem are the drug problems in this country? And if you would ask the Drug Enforcement Administration or the Department of Justice or Health and Human Services and on, you could get a lot of different people to give you, just like the blind person describing the elephant, you could get a lot of different parts. So they established this office, and it's a very small office, so that Congress could get a handle on what's going on with our drug problem, and then more importantly, what are we going to do about it? And we coordinate a lot of different federal agencies. There's no one drug budget. There's about $26 billion of federal money, though, that is spent in this area. Each year, the President of the United States is required by law to issue what would be called the National Drug Control Strategy. It has the force and power of budget control and direction to every federal agency, from the Department of Justice to Health and Human Services to the Department of Education, to tell them what they should be doing in order to work together, to not be redundant, to work collaboratively. But I think also more importantly, because we have some very smart, very dedicated people on this issue, just like here in federal service, state service, and the private sector, this program, this policy, is also used by states and cities and counties as a template about how to go about addressing our issues. You can look at these numbers. I think they're absolutely staggering when you see the prescription drug problem, and I think many of you know these numbers all too well. But I was surprised. So here I am, longtime police professional, concerned when I was the commissioner here in Buffalo during the 9 years in Seattle, concerned about what hurts people. What's causing pain in my community? Is it robberies and muggings? Is it car crashes and DUI? Sure, it's a lot of those kinds of things. But when I was getting ready for my confirmation hearing with the Senate Judiciary Committee, I have a group of people, and they're all playing various senators, and they said, well, and you do know, of course, that more people are dying from drug overdoses driven by prescription drugs than are dying from gunshot wounds in this country. And I'll tell you, I was surprised. I said, no, actually, I don't know that, and I pay attention to these kinds of things. And you know what? If I don't know it, and when I went out and tested my friends informally, colleagues like prosecutors, judges, police chiefs, and sheriffs, they weren't aware of it either. So as a couple of the previous speakers just mentioned, this has been an issue that really is below the radar screen. But because of your work and because of your efforts and because of the work being done by Bill and so many others, it really is getting a lot of attention. Well, these are kind of the facts about extended release formulas. These are all, we're talking about the opiate painkillers. And you can see the number of prescriptions that are issued for these that come out of our outpatient retail pharmacies. And again, these are things that you know, I think, very well. Emergency department visits are important to recognize also. We're going to talk in a few minutes about the fatalities. But if you think of what we're dealing with when it comes to healthcare costs in this country and how do we contain those, how do we reduce those, but then think about the cost of someone going into an emergency department. And it's incredible, but also think about the impact that a drug overdose or the abuse of a prescription drug has on any other ailments or any other diseases or illnesses that this person might have. It might make it, one, much more difficult for that clinical practitioner to understand exactly what is the problem, because sometimes the abuse of drugs masks other problems. So it's not just an issue that tears at our heartstrings, that affects us from the loss of a friend or a neighbor. This is clearly an issue that affects our economy also. Healthcare costs, jobs, etc. You know, the other night I was in Tuesday night in New York City, and there's a wonderful organization called Partnership at Drugfree.org. These are the people that do the ads on television, and they have a huge focus on getting ads into the hands of adults so that they understand this problem better. So the MC that evening was Scott Pelley, who was the CBS Evening News anchor, and he got up, I was talking with him, he got up and went to the podium as part of his duties in introducing people. And he said, but you know, I want to tell you something. He said, the other day, he said, I had lunch with one of the CEOs of one of the largest companies in the United States. And he was talking about what he called his heartbroken feeling when he attempted to open up factories for people that need jobs, that have good, that are well-paid jobs. And he said, I'm heartbroken when I can't fill some of those positions because people don't test drug-free. And there are about 6,000 employers in this country that do that pre-screening for drugs. And so there's another effect on our economy. Substance abuse and dependence, and did I change the wrong? Well, let's just see. Substance abuse and dependence on psychotherapeutics. These are the kind of drugs we're talking about. Drug-induced deaths over other injuries. By the way, I have some information that I don't think has been officially verified or released, but just within the last month, the Los Angeles Times released information and said for the first time ever in our country, more people were now dying from drugs than from car crash deaths. And the most recent information that Bill and I had been exposed to showed that in 17 states, more people were dying from drugs than from car crashes. Well, the Los Angeles Times has looked at the data and published a large Sunday article saying that right now in the United States, more people are dying from drugs than are dying from car crashes. That makes it the #1 cause of accidental death. Unintentional drug overdoses, we only go to 07 because that's kind of official data, but it's around 33 or 34,000 people right now. You know, you look at those numbers and those numbers are absolutely staggering. Admissions to treatment centers, emergency department visits, non-medical users, our economic cost. Well, what's so unique, what's so different about prescription drugs that makes it so deadly and in many ways so appealing? Particularly to young people, they don't perceive the risk. This isn't something that's purchased in a piece of tinfoil or a little piece of plastic. It isn't purchased behind a gas station or out of a drug house. This is something that comes out of a prescription pill bottle. It comes out of a medicine cabinet. And that accessibility through the medicine cabinet, by the way, in the interviews with people who abuse these drugs, 70% of them talk about getting these drugs from a friend or a family member. Well, the smart thing that the United States Attorney and so many others are doing across the country is this coordinated effort, because it isn't just a law enforcement or a prosecution effort. And so we have a program that was released in April of this year, in which early on for a number of months we brought everybody together from the Food and Drug Administration, from the Centers for Disease Control, and for so many others to really talk about this issue and figure out, well, how do we attack this and how do we deal with it in a holistic way? Education goals for parents and patients. Well, that's one of the keys. By the way, you won't see until the very last where we talk about the criminal justice or the enforcement side. What you will see are the parts about education, not just for young people, about the fact that even though it's in a prescription and it came out of a medicine cabinet, that it can be addictive and that it can be deadly. But more importantly, we're looking at these other parts about educating parents. And that's what all of you are doing. You're all these messengers to people about the problems that go with this. Healthcare providers. When I visited doctors, when I visited several different medical schools, and I asked, well, how much information does a physician actually get in their medical training about addiction, about dependence, about tolerance, etc.? You find very little, if any. These are busy hospitals, these are busy people going through learning tremendous amounts of information. But here's something that really needs to be addressed, and I've received an awful lot of support from people in the medical community about how to deal with this. And this tells you a little bit about who's writing those prescriptions, where they're coming from. I just recently spoke to the American Dental Association. It had been very common, especially with tooth extractions, to write prescriptions for a large number of these pills. They have come down and recognized some of the problems, particularly when you think about the extraction of wisdom teeth among kids that are 16 or 17 years old and can be very vulnerable. And it was a woman physician from the Food and Drug Administration that remarked to me recently. She said, yeah, my daughter had 2 wisdom teeth on this side removed, and she came home and she said, look at this, Mom, I have this prescription for 30 OxyContin. She said, do you know how much those could be sold for in high school? And she said that was a real wake-up call to her. So all of these different groups are really coming on board to reduce this problem. And these are the extended release. Well, I told you about where we're missing the gap with physicians. Let me tell you, we're also missing the gap with pharmacists, because pharmacists need to be and are becoming much more aware of these. And pharmacists, even though they're very busy also, we find more and more, hear more and more stories about where they're picking up the phone, calling a physician saying, well, gee, are you sure this is really necessary? Or I think this pharmacist has had some experience with that particular patient who might have been coming in with prescriptions from other physicians. And so we're seeing that in all of these different levels, as people become more aware of the problem, that we're making a difference. Every state but 2, New Hampshire, where I was last month, and Missouri, Every state but two has something that the Attorney General remarked about: prescription drug monitoring programs, electronic databases that make a huge difference. Medical boards can find out about physicians who may be overprescribing, and physicians who access and use that database can identify patients who are doctor shopping. How do you dispose of these things? We're all environmentally conscious today. We're all concerned about, gee, I don't want to throw these things in the garbage. I don't want to put them in a landfill. I don't want to put them, flush them down the toilet. And so there's, as many of you know, not a lot of bipartisanship right now in Congress. But within the last year, both parties were extremely supportive of a bill to allow the Drug Enforcement Administration to rewrite the rules on how to get rid of these things in a safe manner. The President signed that legislation. The Drug Enforcement Administration is doing the rewrite on the rules to identify ways that not only can prevent diversion, but also work as in a method to get rid of the drugs in an environmentally conscious manner. In between time, though, as they're rewriting the rules, well, what's been going on? Well, the drug take-back programs. And in fact, next Saturday, October 29th, will be the third drug take-back program that DEA, along with 4,000 state and local law enforcement partners, is supporting. So they'll collect these drugs. There are drop-off places that are easily identified, and the drugs will be disposed of in a proper way. We think that's important, both for two reasons. One is people are cleaning out their medicine cabinets. These are often unneeded drugs, or they have gone past their due date, the dates that they should have been disposed of. But more importantly, it also brings it to the attention of the people that, well, what is in my medicine cabinet and what is there? We've recently put my mother-in-law's in hospice care right now, and as I was cleaning out her medicine cabinet and finding morphine and finding a lot of other things in there, it really brought it home to me. And so on October 29th, on Saturday, I'll be getting rid of all those drugs in a safe way in New York City with a lot of other colleagues that are doing the same thing. And lastly, in that four-part strategy, lastly, we talk about enforcement, because unfortunately there are physicians that not only abuse their ethical rules, but they also abuse federal law and state law. And so there has to be an enforcement mechanism. There was no place greater than, within the last year, than Broward County, Florida. Now, that's a place I think a lot of Buffalonians are kind of familiar with, down around Florida. I don't know. You usually go down around June, I know, or July, and because you don't want to miss the winter here in upstate New York. But when I was down there, there were 26 pill mills. 26 pill mills in which there were physicians cranking out literally hundreds of prescriptions for these very powerful, very addictive painkillers. Let me also mention, by the way, we're not trying to turn the clock back. When these drugs are prescribed properly and the oversight is provided, we know that they can be in many ways life-giving to people in severe and chronic pain. But we also know they can become easily abused and addictive, and we also know that there are people that abuse that. Well, the state of Florida has really taken this issue on quite strongly, and just recently they are down from 26 pill mills to 1. Well, that's the good news. Bad news is that now they're seeing pill mills in Ohio, in Appalachia, places in West Virginia, Kentucky, et cetera. And so you have to be really concerned about these pain clinics and how they're being run, how they're being managed. Well, this is really one that I'm optimistic about, that we can do something on, and we can reduce the toll and we can reduce the problem. And it's because of you. It's because there's no single solution. No one's looking at the prosecutor or the police department or the Drug Enforcement Administration saying, fix this problem. We're kind of all in this together, and we all have an important role to play. And the success that's going to come is going to come as a result of coordination, working together. Tough economic times really tell us that we have to figure out ways to collaborate and make sure that the vital dollars that are there and the narrow numbers of dollars that are available are used in a way that makes the biggest difference. So I commend all of you for what you've done. Let me go back to our website for just a second. There's a lot of information on our website, whitehousedrugpolicy.gov. There's a lot of information that I know is being made available to you. And I think I have a few minutes for questions. And I don't know how we're going about. Are we shouting those out? Or are we, I have a couple minutes if you have any questions, anything that you'd like me to answer about the drug policy. Yes, ma'am. And the question centered around a physician, a psychiatrist, in prescribing benzodiazepines, and the fact that there are some clinics, and actually there was a couple articles recently about places that have gone, for instance, oxy-free or other locations. And I'm not sure that's exactly the right answer that we're looking for. Because we're not in the business. When you think about it, the federal government doesn't tell physicians how to practice medicine. Actually, that's really the role of each of the individual states. And working through those state professional associations, I think, can make the most difference. I'd be happy to give you additional information or refer you to people in the office. And I think I have time for about one more question. I've kept you longer than I thought. Yes, ma'am. Yes, the PowerPoint is available, and we'll make sure you can go to our website, but I know that all of the contact information is also here and available. We try to tailor it or adapt it a little bit with particular areas for different states that we have visited, but the leadership that I'm seeing here today and the fact that so many of you are out to address this issue in a really collaborative way just tells me that you're on the front edge of how to make this problem less of a problem. Thank you all very much.
Thank you, Director Kurlikowski. I agree with you wholeheartedly that law enforcement has a role to play, and at the federal level, thanks to the leadership of our resident agent in charge of the DEA, Dale Kasperzak, as well as the leadership of my office as Narcotics Division, Timothy Lynch, we've arrested over 70 traffickers in prescription pills in the last year and a half, 70. And we've convicted so far the ones who have proceeded through the system. Others are still pending and are certainly presumed innocent. But that is not enough, and I agree on that comment as well. We cannot arrest our way out of this issue. We will do our part along with our local, county, and state law enforcement partners, but all of you, I think, recognize that it is a multifaceted approach that is needed, which is exactly the reason for this conference.